Liver is a very important organ of our body. It is actually one of the largest organ of the body. It does almost 500 functions, which actually is not just required for one organ but also required for health of rest of our body as well. Giving an example, if we take an example of a computer, if we consider electricity as heart, then CPU is like liver. If your CPU is working well, then your computer is working well. Similarly, if the liver is working well, your rest of the organs are working well. But once it starts to get affected, then the symptoms start to appear in all the body organs. There is a good as well as a bad part about the liver. The good part is there is too much of liver given to us by the God. But then the bad part is we don't come to know when it is getting affected or when it is failing till it is too late. Normally it is said till the time 2/3 of the liver is affected, you don't get any symptoms. But after that, the various kind of symptoms start to appear. Be it jaundice, be it water collecting in the belly, be it effect on the brain, be it decreasing the muscle mass, be it loss of bones, swelling of legs, loss of genital function, loss of hair, and many others. But then important thing for us to understand is how to take care of the liver. Liver has an immense regenerative power. So if we treat these diseases in an early stage, the liver regenerates back to full size and a normal size and a normal shape, and people get their normal liver function back. But then if it is missed and it reaches the advanced stage, which is like stage of liver cirrhosis, or there is a cancer developing in the liver, then the only treatment option that remains in those kind of situations is liver transplant. So today I'm going to be talking about one of our patients who had liver disease secondary to viral infection, and which led to his liver getting to the stage of liver cirrhosis, and on top of it he developed liver cancer. And the only treatment option in this kind of a situation is a liver transplantation. So he came to us with advanced liver disease, and we evaluated him, and we found out that his liver was in advanced stage of cirrhosis, and there is liver cancer as well in his central part of the liver. And we found out that his other body functions were okay, and we decided to take him up for liver transplantation.
محمد تقی علیزاده هستم از مزار شریف از افغانستان. دیگه 5-6 سال پیش آمده بودم هندوستان. در تداوی زردی سیاه داشتم. تداوی ما انجام دادم. جگرم مشکل پیدا کرد. در پیش هر شفاخانه ای که رفتم خوشم نامد، تداویم نشد. آمدم جی پی اسپتال، همین دکتر عبیدیپ چودری میگه، همین گفتن تداوی دمیجه میشن، خوشم آمد، همینجا انجام دادم. جگرم عملیاتش انجام دادم، فعلا نرمال است، خوش هستم.
Patient name is Muhammad Taqi Alizada. He is from Mazar Sharif, Afghanistan. इसका प्रॉब्लम ये है कि 5 साल पहले हेपेटाइटिस बी था. इस 4-5 साल बीच में तो 5-6 बार इंडिया में 2-3-4 अस्पताल में गया था. वहाँ तो कोई इलाज नहीं हो गया इनका, तो यहाँ जीपी अस्पताल में इससे पूरा इलाज हो गया. और ये पेशेंट कह रहे कि मैं बहुत खुश हूँ यहाँ से. सर अभिदीप चौधरी से बहुत खुश है, शुक्रिया अदा कर रहे हैं. यहाँ इनका लिवर ट्रांसप्लांट बहुत अच्छा हो गया. अभी पेशेंट बिल्कुल ठीक है, नॉर्मल है. बस पेशेंट डोनर दोनों ठीक है. बस यहाँ से बहुत खुश है, डॉक्टर और पूरा स्टाफ से बहुत खुश है यहाँ. बस यही शुक्रिया अदा कर रहे हैं.
His son, who's a student, decided to donate a part of the liver for his father, and on evaluation we found out that the son is fit to donate, and he has a normal liver, good sized liver, and if we take a part of the liver, there is no risk to his life or his future at any level. So we accepted him as a donor.
This is Muhammad Alizada, son of Muhammad Taqi Alizadeh from Mazar Sharif, Afghanistan. I heard for about 5 or 6 years ago that my father has problem from hepatitis B, but in these years he came in India for about many times to show himself, to treat himself, but he didn't treat, the others doctor didn't treat well, and his liver has a little problem that doctor said you should have liver transplant. Because of this we came to a different hospital, but we heard that JP hospital is better than all of them, and they are good staffs, they are good doctors in JP hospital. We came here and we did this surgery in JP hospital, and we are thankful of God and thankful of team of Dr. Abhideep Chaudhary for doing this surgery. Now my father and I am happy and we are well. We will go to our country after finishing the process in here, by God willing.
A little bit about organ donation. Whenever someone, some family member wants to donate part of the liver for another family member, we do a lot of investigations, tests for that person. The idea of doing those tests is to find out whether that person's liver is healthy, the size is good, whether we can actually split the liver and take out a part of the liver or not, and doing other body functions as well to make sure that the surgery, the donation, does not affect his life at any stage at a later date. So once we are sure that the surgery is going to be absolutely safe for him, only then we accept someone as a donor. So like in this case, he was found to be absolutely fit to donate. So we took him up for surgery. At the same time, his father was also taken up for surgery. By doing all these procedures, we are able to get good success rate of more than 95% success in liver transplant surgeries and 100% success in donor surgeries. After the surgery, the patient was shifted to ICU. He was in ICU for 4 days, recovered very well, and then was shifted to the ward, and is now recovering very well after the surgery. And I wish both the father and son a very happy, healthy and fruitful life.